Hey, what's going on, Drew and the other Booth boys? My name's Corey. I had a question about SSRIs, as I hear you, Drew, bring that up a lot. I think that the way you talk about how it kills sex drive, I think that's the cause of my last two relationships going down in flames. Because, see, I have no problem beating my meat, the phone's right there, smoke some weed. I don't take the Benadryl or nothing, but I still have no problem beating the meat, but I didn't want to fuck. I had really, great looking significant others, but I just did not want to fuck. When I stopped taking the medication, definitely still didn't want to fuck. So I don't know what's going on because the doctor says don't stop taking the medication. So what do I do? Do you have any recommendations of which SSRIs I should take that might help if they seem to be working? Like the rest of my life seems great. Any ideas on what to transition to? Appreciate it, guys. Stay high and tight, and you better come up in May.
It's actually a really serious question. And the fact that you continue to have changes in your libido after you come off the SSRI, there's a whole world of persistent sexual desire problems and persistent sexual dysfunction from antidepressant medication. I actually did a whole podcast on this. There are communities of people that are trying to raise awareness about the fact that not only can you have sexual dysfunction of any type? You can have erectile dysfunction, desire dysfunction. Like you're saying, you kind of can masturbate, but you can't have really interest in sexuality. That is the medication. And some people have that persistently even after they come off the medication indefinitely. And there's various theories about it. One theory is it's sort of a neuropathic kind of process, but be that as it may, it's kind of serious. The one that's the least likely to cause it is Lexapro. Typically, you don't want to, if you're having this, the psychiatrist should get you first of all, should see a psychiatrist and not a primary care doctor, and they should get you off SSRIs entirely. So it's actually a bigger deal than you might imagine.
I have a question about this, Drew.
Yeah.
So how much do you think that they are trying to advance medicine in terms of like pharmacy options, like in terms of medication you can take, or how much are they just trying to we have Lexapro now, so let's push that and just deal with the side effects? Or are they trying to develop things without these side effects?
From the moment, this is how pharmaceutical research works. From the moment you pull a molecule off the shelf and identify it, you have 10 years to bring it to market and profit, and then you lose the patent. 10 years from the moment it comes off the shelf. On average, it takes 5 years and over $1 billion to bring a new drug to market. So they're left with 5 years to make their profit. Then it goes generic, and then it's pennies. So they only have 5 years with these drugs. So that's the only time they push them is during those years when they can make profit. And when there are new things that seem to have new benefits and seem to be better than previous things, doctors use them, even though they get a little more costly. But they have to recoup around somewhere between $800 million and $1.5 billion, depending on the drug. That's why the pharmaceutical industry is such a mess, because it costs so much money to do the phase 3 trials and get things through the FDA. Now, the easiest thing to do is to take a drug you already have and change it a little bit and retest it for, you could do that in a couple of years. You can get it through the FDA very quickly. And that's why there's a million different Pepcid, Xanax, Tagamet. That's why there's a million different Protonix, Prilosec, Nexium, because they're called Me Too drugs. That's the most profitable way, because then you have 7 or 8 years to make your profits back. And usually it doesn't cost as much to get it to market. So that's why that happens.
And then a follow-up question on that. Yeah. So is there any kind of conflict of interest or any law or policy that would prevent one company that, say they make a drug and it has these side effects, can they then make drugs that address those side effects, or is that a conflict of interest?
That's an interesting question. They generally don't, in my experience. I don't know why. Usually what happens is a company comes up with a medication that doesn't have the side effects rather than something to treat the side effects. And usually what ends up happening is the doctors are using off-label medication to treat the side effects. I guess it's probably not profitable to treat there's not enough people with side effects to make a profit. You see what I'm saying?
Yeah,
Does that make sense?
I didn't imagine that. I mean, largely why I got off medication was the side effects, and then it was trying to balance out the side effects with more drugs, and it just seemed like a never-ending kind of
but most of the more drugs were doctors doing things off-label. that's not FDA approved or anything,
Gotcha.
and that drug companies didn't bring to market. We just know from research and clinical practice that you can use these things off label.